This half hour with pressure to prescribe. If you've spent time as a hospital patient, you may recall receiving a survey about your experience. Well, it turns out your answers can impact how much the hospital is paid, and in some cases, even what your doctor earns.
The government-mandated patient satisfaction survey is meant to reward quality care, but some doctors say it's had an unintended consequence, fueling Americans' dependence on prescription painkillers. Brook Silva-Braga is here with the story. Brook, good morning.
Good morning, Anthony and Alex. These surveys are part of a major effort in American medicine to pay for effective care rather than just how many procedures are performed. And many healthcare providers say the surveys are helping to do that, but a handful of the questions are raising concerns because doctors say they seem to encourage the prescription of pain pills. Brooke. We met Dr. Mark Woodard in the ER at Bristol Regional Medical Center in eastern Tennessee. Appalachia is ground zero for the country's opioid abuse crisis. 2 million Americans are hooked on pain pills. Overdoses kill more people than gun homicides. On the shift you're getting off now, did you see anyone seeking drugs?
Oh, yes. I'm on every shift. I mean, 2 or 3 today.
But turning away drug seekers can be bad for business, doctors told us, in part because of the rise of patient satisfaction surveys. In addition to asking if the nurses are polite and the hospital is clean, the survey has questions like, how often did the hospital staff do everything they could to help you with your pain? 28% of doctors are paid bonuses based on patient satisfaction, according to the industry group Physicians Practice. And hospitals with better scores get bigger payments from Medicare and Medicaid. Do any of you think these scores are leading to more prescriptions being written?
Yes.
Yeah.
Oh, yes, definitely.
Do you think it's leading to more people becoming addicted?
Of course. Yes. Yes.
Doctors Dana Barlow, Ramon Ibrahim, and Joe Smitty have practiced medicine in Appalachia for a combined 98 years and say more and more of their patients have become addicted.
It's getting worse year after year.
The administrator will come up.
Dr. Barlow says pressure on hospitals to score well led to pressure on doctors, including him, to prescribe opioids. And how does that conversation go?
Well, it goes basically, we want to make sure that everybody in the emergency department is happy and their pain is relieved, and so you need to do that.
Do they say, let's get the scores up?
They tell you to get the scores up, yeah. I've seen physicians fired because of not adequately addressing pain management.
Researchers at the University of Wisconsin found 1 in 5 doctors reported their jobs had been threatened over the scores. Some of them have ended up looking for work here at the clinic Dr. Smitty runs.
We see physician applicants who have lost their previous job because of the prescribing habits that were placed upon them that they weren't comfortable with in a previous job.
In response to similar concerns, Medicare and Medicaid will stop paying hospitals based on their pain scores beginning October 1st. But many hospitals will still use the scores to rate their doctors, using reports created by private survey companies. Dr. Jim Merlino is the president of strategic consulting for the biggest of those companies, Press Ganey. He says comparing physicians makes doctors more accountable.
Let's say you're a physician that doesn't believe in giving a lot of pain medication. Are you going to allow a patient to sit in bed writhing in pain? Would you allow that? I wouldn't. I would want to know as a provider or as a leader of a group or a hospital if that was happening in my patients.
So you do think it's fine for doctors to be compared to other doctors based on these scores?
I think that getting data points out to physicians is important, yes.
We talk about satisfaction scores every day.
Back in Tennessee, Woodard, who leads a group of ER doctors, has negotiated a compromise with his hospital. When patient satisfaction bonuses are calculated, questions on pain are stripped out. Why would you care about not being graded on pain? What difference would it make if you were?
Well, because it would put us under pressure. Do I write this patient a small amount of narcotics where they'll be happy with me and give me a good score where I can either keep my job or get a financial bonus? I think human nature says you're under pressure to do that.
Doctors groups told us those type of arrangements that ignore the pain questions are becoming more common, but with no national rules about how the scores are used, it remains a hospital by hospital decision on what to do about doctors with low pain management scores. Anthony?
Brook Silva-Braga, fascinating. Thanks, Brook.